Hello, I'm so excited to be here. My name is Cindy Bautista, and I'm an associate professor at the Egan School of Nursing and Health Studies. That's Fairfield University, Fairfield, Connecticut. And over the next 25 minutes or so, I'd like to share with you something that I've created. It's using visual aids to validate your stroke nursing knowledge. The first visual aid that I'd like to create for you is brain anatomy. And this is going to correlate with where a stroke occurs, whether it's a bleed, a hemorrhage, or an ischemic stroke. So the first thing and I hope you guys have pens and pencils. I hope you guys will draw along with me because if you can envision these drawings in your mind when you're caring for stroke patients, I think it will be quite helpful. So let's start with the brain, and it's 3 pieces. So draw the cerebrum, the stem, and I call them the balls, the cerebellum. Immediately go ahead to the cerebrum and put an H in the middle of the cerebrum. By doing that, you've taken the cerebrum and split it into the 4 lobes. The frontal lobe, the parietal lobe, the occipital lobe, and the temporal lobe. I would also draw another line here in the frontal lobe because the frontal lobe is hot for level of consciousness and motor function. You want to remember the leg is at the top of the motor strip, the arm is in the middle of the motor strip, and your face is at the bottom of the motor strip. So if people infarct, especially the anterior cerebral artery, that feeds the leg portion of the motor strip. The middle cerebral artery feeds the arm and face portion of the motor strip. I'm sure you remember parietal is sensory, so that is sensation, numbness, and tingling. Occipital is vision, so you would be looking at visual difficulties. The temporal lobe is seizure. It's a hot spot for seizure activity. Some other things you want to try to remember, if they infarct on the left, they more than likely will have speech difficulties. If they infarct on the right, they'll more than likely have neglect, left-sided neglect issues. All right, let's move on to the cerebellum. So you want to think of 1, 2, 3 things. You want to think about coordination. You want to think about balance, and you want to think of a nystagmus, okay? So again, if your patient comes in and is ataxic, they're uncoordinated. If they complain of dizziness, then that's a balance issue. And if you look at their eyes, they're all jerky-like, that would be a nystagmus, indicating those 3 symptoms, cerebellar infarction or bleed. Last but not least is your brain stem. So the brain stem, if you make these 3 like little sections or 3 little balls here, that will get you to remember that you have a midbrain, a pons, and a medulla. Again, the brain stem, you want to think of 4 things here. So there's 4 things that the brain stem will do. First, it's the RAS, right? So that's your reticular activating system. That's your awakeness and alertness. It also has motor function, mostly in the anterior portion of the brainstem. It also will give you sensation, sensory issues, and that's mostly posterior brain stem. And last but not least, I know it's your favorite, cranial nerves. So those 10 out of the 12 are definitely going to be housed on the brain stem. So again, if you can just simply imagine this visual of your brain, the cerebrum, the brainstem, and the cerebellum, and just quickly know the main function of each of these pieces, you will be able to identify the deficits that your stroke patient has. Or if you identify their deficits, then you'll know where the stroke has occurred. Now, since I just mentioned your favorite cranial nerve, I'm going to share two visuals with you. The cranial nerve assessment, so how to remember those 12 cranial nerves and what to assess. And then I also want to share with you, you'll see on the next slide, the location of these cranial nerves, as that will come into play when you do your assessment, or understanding what to assess if your client has infarcted or bled into their brainstem. All right, the first one I want to give credit to Barbara Balek. This is called the cranial nerve face. So maybe some of you have seen this before, maybe some of you use this. So we're going to take the numbers of the cranial nerves and create a face. So let's get started. In the middle, everybody write down 1, because you have one nose. Cranial nerve 1 is olfactory, so you would test smell. 2, you have 2 eyes, so go ahead and draw or write a couple of 2s above the nose. That again, 2, optic nerve, and that's all about vision, visual acuity. 3, cranial nerve 3, ocular motor. So ocular motor is pupil size and reaction to light. But it also has to do, we're going to draw some 3s sideways over our eyes to think about ptosis, or a lid lag. So cranial nerve 3 has to do with that. Cranial nerve 4, it's down and in. It's part of an extraocular movement. So under the nose, you're going to take a little and write some 4s, like little nostrils, bringing the eyes down and in. 5 is trigeminal. So 3 pieces of the face. So when you draw the 5, come across the forehead, that's 1. Come down the cheek, that's 2. And here comes 3 around the jaw. So when you draw the 5, it makes you think that you would test the motor and sensation of the forehead, the cheek, and the jaw. The next number is 6, right? So we did 5, 6. If you envision drawing or writing some 6s, maybe you could get the feel that they're like ears. So draw a couple of 6s as ears of the face. But be sure to do it across from the 2s, the eyes, because 6 is lateral gaze. So you want to kind of remember that. So by drawing 6s as ears, you can envision that you would test lateral gaze. You know, you say, look over here, look over here. 7 comes next. That's a facial cranial nerve. And so draw some 7s and make sure you think about taking the whole face. So draw a 7 taking the whole face. Because 7 is a motor and sensory function of the whole face, versus most stroke patients have a lower facial droop, which has to refer to the lower motor strip. So cranial nerve 7, that is hot for what? Bell's palsy. So the big deal here is eyebrow raising. So raise your eyebrows, raise your eyebrows. If they cannot raise their eyebrow, that's a Bell's palsy. If they can raise their eyebrows, it tends to be a stroke. All right, let's do the next one. 8 is acoustic. I think of acoustic guitar, acoustic cafe, acoustic hearing, earrings. So give your face a couple of earrings in the shape of an 8 to remind you to test for hearing. Next comes 9. You never say 9 by itself. You always say 9 and 10. So go ahead and draw a tongue. And in the back of the tongue, you want to number 9 and 10. So this is all about a gag. This is going to be testing or looking for dysphagia, the difficulty in swallowing. Next is number 11. So 11 is shoulder shrugging. So go ahead and draw a couple of 11s to look like shoulders. And last but not least is going to be 12. And that we're going to put on the tongue because 12 is hypoglossal. And this is where we say stick out your tongue and where we see if it's hanging left or right. Wow, look at that face. So again, using the numbers of the cranial nerves to create a face to help you remember what to assess for cranial nerves. So this is cranial nerve location. So I always had troubles. They would say my patient has a pons infarction or a medulla bleed. And so I could never remember where the cranial nerves were. So for me, I created this, I call it the snowman effect. Because again, your brainstem has 3 pieces to it. So I drew this 3 like balls or 3 circles. So again, this is the midbrain, this is the pons, and this is the medulla of your brain stem. So what I did is you have 12 cranial nerves, and I divided that over the 3 sections of your brain stem, and that gives me a reminder that I could easily have 4 cranial nerves on each section. So that's what we're going to do. I'm going to draw 4 lines on each section, but I'm going to start at the bottom, and you'll see why. So on the medulla, there's 1, 2, 3, 4. On the pons, there's 1, 2, 3, 4 cranial nerves. Now, when I get to the midbrain, I'm going to split it 2 and 2. 2 on the midbrain and 2 off of the midbrain. Because in real life, that's what happens. The first 2 cranial nerves are not on the brain stem. So how I remembered this is I create the top hat of the snowman. So this is the top hat of I always think of that cartoon, Frosty the Snowman. So there is 2 cranial nerves to create the top hat of the snowman. Now, you can number them up, right? So this is going to be 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. So here, again, is showing you which cranial nerves are on what section of the brainstem. So if you can kind of remember 4 cranial nerves on each section, you'll be able to answer several questions, or you will know what to assess. So for example, if your client has infarcted their pons, if in your mind you can visualize this snowman, you would know that 5, 6, 7, and 8 are on the pons section of the brainstem, and those are the 4 cranial nerves that you should assess or trend for neurological deficits if your client has stroked in their pons. Same thing with midbrain, same thing with medulla. Maybe you've heard of this. My client has lower cranial nerve injury, or my client has bulbar signs. So bulbar is a fancy word for medulla. So again, you would say to yourself, which 4 cranial nerves sit on the medulla? So you would, again, envision, I got a snowman, I got 4 cranial nerves per section. So lower medulla, 9, 10, 11, and 12. Okay, so I'm hoping this snowman effect, if you can remember or envision this snowman, it will help you remember which cranial nerve is in which section of the brain stem. The next visual aid that I'd like to share with you are field cuts, visual fields, because our stroke patients have field cuts. They have visual difficulties. So the first thing to do is let's lay out the drawing. So in your mind or in this drawing, go ahead and start with 2 eyeballs and connect the eyeballs by creating a V. And then at the bottom of the V, go ahead and make like a star-like or pom-pom kind of design. And then behind the pom-pom or this poofy thing, go ahead and draw or lay down some tracks. So if you can just envision this particular visual, the eyeballs, the V, the pom-pom, and tracks, this is visual fields. So what we're going to do here is let's talk about this section here, then we'll talk about this section, and then we'll talk about this section. So the first one is called Cranial Nerve 2. It is an optic nerve, okay? And this happens in trauma, or it is affected in trauma. And it is same side injury, okay? So that optic nerve, if you get hit on the left or you get hit here, let's label that up. This is the left side, this is the right side, okay? So if I get hit on the left, I'll probably take out my left optic nerve. So over here, on like kind of this column here, this is what we'll call the field cuts, okay? So here, we're going to draw this one. So draw two eyeballs, same thing, left and right. So if I am hit on the left, I'm going to take out my left optic, and that leaves me blind. So color in, and let's see if I can write this, blind. So the field cut that you get in trauma, taking out your optic nerve, is blindness. And it's the same side injury. Next is called the optic chiasm. Optic chiasm. And this is affected with a pituitary tumor. Okay? So your pituitary gland sits underneath your optic chiasm. So the field cut that comes with that is, again, draw two eyeballs, one left, one right. It's called bitemporal. Bitemporal. Hemi, half, anopia, can't see. So split the eyeballs in half and only color in both sides on the temporal sides. So, right, that's on the outside. So color in this one and color in this one. Okay? Now, I don't know about you, but that looks like peripheral field cut. Because personally, that's what I hear all the time. Oh, they got a peripheral field cut. Well, we really should stop saying that. We should be saying, ooh, it's a bitemporal hemianopia. Ooh. Or they keep bumping into things, or they keep walking off to one side. So, again, it is a peripheral field cut, but the fancy name is bitemporal hemianopia. All right, let's get to stroke now, finally. So this third section here is called Optic Tracks. Okay, so Optic Tracks. Tracks, okay? And this is stroke, so this happens with stroke. This is the area that's affected with stroke. And this is opposite. It's opposite side injury. That's what I should say. Opposite side injury. Now, the hot artery that plays into this is your middle cerebral artery. So I'm going to put an MCA here, and I'm going to put an MCA on the right. So this is your left MCA. This is your right MCA. So you guys get it, right? If I throw a clot to my left MCA, means I cannot see on the right. If I throw a clot to my right MCA, I cannot see on the what? Left. Okay. So let's draw that out. So go ahead and draw your two eyeballs. Split them in half. And it's called Anonymous, hemi Again, anopia. All right. So when you color it in, you've got to color it in on the same side. So let's do left, okay? We'll do the left MCA. So that means they cannot see on the right. So I've got to color in the right hemisphere. Coloring in the right. Giving them a right synonymous hemianopia. Oh my gosh, that is so confusing. It's hard to understand, but again, it's the middle cerebral artery that feeds the optic tracks. So, and again, it's opposite side injury. To me, I would mostly focus in on left because most common type of infarction is a left MCA. So that means that your client cannot see on the right. We call it a synonymous hemianopia. Last but not least, I would like to share with you the cerebral vasculature of your brain. And again, stroke is really all about these arteries. And so to me, how do you remember the arteries? Where are the arteries? What do the arteries feed? I'm going to create here, and again, please feel free, draw along. This particular visual aid is going to be a stick figure. So, a stick figure. They have a head, they have a body, and they have some legs. So if you can envision this stick figure when you're thinking about the arteries in your head. So again, head, body, legs. You're going to give this stick figure many arms, okay? You're also going to give it some ears, so give it some ears. And you're going to give it 2 pieces of hair, okay? And now, I don't know about you. So, again, if you could just draw this stick figure, if you could just envision this stick figure, a head, body, legs, many arms, 2 ears, and 2 pieces of hair. This is ideally the arteries in your brain that are definitely all of these get affected due to stroke. Now, the other thing is, I don't know about you, but this is looking a little bland or a little boring. So what I want you to do is add some bling bling. So first, let's add some earrings. So make those come straight out the ears. And then give it a nice bling bling necklace, okay? So there's a method to my madness. So add 2 pieces of bling bling, earrings and a necklace. So what you want to do is above the necklace, we call it anterior circulation. Your client will have unilateral deficits. Below the necklace is posterior circulation. So any of these arteries below the necklace, your client will present with bilateral deficits. Okay? Now, let's label up the arteries. Let's start anterior because that's 80% of the strokes tend to happen up here, anterior. There's 3 major arteries here, okay? So we'll number up 1, 2, 3. So we have an ACA, we have an MCA, and we have a carotid. Okay? So the 2 pieces of hair are the ACA, the earrings are the MCA, and the ears are the carotid. Things to remember, ACA feeds the leg portion of the motor strip. The AMCA feeds the arm portion, and the carotid feeds your eyeball. So this tends to have visual difficulties. Okay? Now, below the necklace, again, 3 arteries. So we'll go 1, 2, 3. We have a basilar artery. We have a vertebral artery. And we have cerebellar arteries. There's many of those. Okay? So again, body, basilar, V. See the V? The V, vertebral. Okay? And then many arms, again, feeding those balls, is your cerebellar arteries. Okay? That's all the time I have for you. I hope these 5 visual aids or these visual drawings will help you or to reinforce your stroke nursing knowledge. And you would be able to use these at the bedside when you're caring for your patients to help with your assessments. Okay, thanks again very much for this opportunity. Take care. Bye-bye.